Hi, Lisa Marie Kosas of Global One Health. In this video, I want to talk about the 90-90 hip stretch as part of the hip joint series. I recently posted a few videos on hip CARs, controlled articular rotations, so I thought this would be a great time to address an isometric hold or a static stretch for the internal and external rotators of the hip complex. So the 90-90 hip stretch is done with each leg in a 90-degree angle, and I'll talk about that in a moment. But I want to preface it by saying it's very important to listen to your joint structures. Everybody has a different degree of flexibility in the soft tissue, as well as different degrees of range of motion and mobility in your joint structures. So what the position I may get into, you don't want to force yourself into position just to look like the position I'm sitting in, and I want to talk about that. It's very important that you don't force your leg or your pelvis or your body in any position if the joint structure does not have that full function or that range, and possibly risk injuring yourself. It's definitely not worth it. So having that been said, when I talk about the 90-90 position, that means that each leg is at a 90-degree angle. So if I turn to this side, this is just going to show you how my leg is coming as an extension out of my body, right? So the front thigh, technically and ideally, is aiming straight out. So if my pelvis, shoulders, and chest are facing straight forward, the forward leg, which is an external rotation, is aiming straight out, and then my shin is perpendicular to the screen, as you can see there, and now my knee is going to be in line with my hip. Now my back leg is also at 90 degrees. Now ideally, my thigh is coming at a straight angle out from the lateral side of my body, and my shin is creating a 90-degree angle perpendicular to that. So meaning that there's a 90-degree angle in the joint structures, hence the name 90-90. Now, if you have enough mobility in the joint structure where that leg naturally can, the outside lateral part of your leg and lower leg can hit the ground, that is great. If you're sitting down and you feel like when you sit down, this is your end range and you can't naturally get it down, don't force it, right? You have to listen to the integrity, maintain integrity in the structures. So that is important. Always listen to your body. Now, the goal is to stay vertically aligned in terms of lateral shift. What that means is that a lot of times when clients first sit down in this position, they'll be somewhere out here. You don't want to be leaning outside the line of that forward leg. Ideally, you're trying to stay within that structure. So having that been said, using the arm outside the forward leg as leverage is going to be very helpful. Place it in a position where you feel you have good integrity in the shoulder girdle. So if I put it too far back, it might make my shoulder go forward, obviously not too far away. So I want to maintain my shoulders open on my trunk and spine. So I'm going to set my back position. Yeah, and then find a place on the ground where I can maintain a good shoulder position. So while focusing on the hip stretch, you still want to be mindful of the trunk and shoulder girdle positioning as well, as that's equally as important. So keeping the shoulders open, the spine long, you want to just use, so if I have a tendency to lean out, I'm going to just push gently that arm into the ground to help guide my body back into this more neutral spine position. Now, the forward leg is an external rotation, the back leg is an internal rotation. So from a side view, the spine position very much matters. So I don't want to be back here. So notice the goal is to keep a neutral spine, not to allow flexion or rounding of the spine. I want to keep my spine neutral, so it's going to bring me on a slight forward pitch. So this is also going to be a great drill to help improve my squat and my deadlift, if that's something that you're working on. And I'm in dorsiflexion or plantar flexion here. So now, in talking about the spine angle, my goal is to think that my tailbone is reaching slightly back behind me. So I don't want to slouch. So if I slouch, my tailbone curves forward. I want to have that sensation that my sit bones and tailbone are anchored into the ground, slightly back. And the front of my spine is very long, because that's the proper angle that I want to be in. Now, you can always ease back and go deeper into the stretch, again, listening to your muscle structures, right? Listen to the muscle tissue. Now, the forward leg is going to get a stretch in the lateral rotators, which are located about here. So as I pitch forward, nice and slowly, I'm going to feel an increased stretch in my external rotator muscle group right here. So I want to find that comfortable degree where I can sit and hold. I'm not making any quick transitions, Stretching does not need to be quick. It is not a speed agility focus point, right? We're just looking for slow, controlled movement. You can opt to hold this position for a minimum of 30 seconds or longer. Or you can just ease back, and you'll see both variations done. So if I want to ease into it, maybe I just start leaning in for about 5 seconds, holding that position, and then I ease back, and then I deepen into it. I can do that a few times, and then I certainly can work then to maintain a complete static stretch here. But you again want to listen to how much stretch you're getting there. Never, I like to use a perceived exertion scale on a 1 to 10. So if 10 is the maximum stretch where you feel like another inch further and you're going too far in exceeding the stretch that's comfortable for yourself, I don't like clients to push to a 10. I say listen to the body. Start at about a 6, maybe 7. Slow, deep breathing, inhaling through the nose always. Exhaling nose or mouth, but just taking slow, long, deep breaths. Focus on maintaining activation of your core isometrically. That's something you can do. Now, in terms of the other leg, for internal rotation, right? So if I just work on slightly bringing that pelvis down a little bit, I'm going to feel a different stretch. So my TFL, which is here, is my prime internal rotator muscle of the hip. So if I just kind of, again, you may not be able to get the pelvis or the hip all the way down. I'll show you from this angle, right? So you may not be able to get that hip all the way down. You're not trying to force it if it can't go down, but you want to just gently think about reaching. I think that's a good word, right? Reach the energy of the hip down as much as you can where you don't feel that you're forcing it in a position that it doesn't want to go in. And then the deeper you allow that to go down, you'll feel a different stretch through the TFL and through this internal hip rotators. But the 90-90, and I'll just do a few moments on this side, the 90-90 hip stretch is great because it's putting your legs in that more end range motion of internal and external rotation. Unless you're sitting in this position or consciously doing this, our legs and hip joint structure are never really in their end range of internal and external rotation. So it's something that's not done on a regular basis. It's not a natural movement that we do in gait by any means or throughout our daily routine. So taking time to actually spend time sitting in this position is very important to allow the muscle structures in that hip complex to really even just be and exist and spend time isometrically hanging out there. Again, you can pitch forward, always making sure that the spine is neutral, because once you slouch, you're not just detracting from the stretch, but you're losing the integrity of the position of the relationship of your pelvis to your spine and trunk. So that is very important that you maintain it. Remember, the arms are in this position. If you feel very comfortable there and you have a natural great mobility, you can certainly take the arms off the floor, but play around with your hand position to get you, to set you up for the most success for maintaining that position. Again, lean forward, hold for maybe 5 seconds, slow, deep breathing in through the nose, and then you can ease back, inhaling, going deep forward in the stretch, and you can either do that several times. A nice way, if you think of 30 seconds minimum, is to do 6 rounds of 5-second holds, moving in and out of it, and then hold for another 30 to 45 seconds after that in that static stretch. Allow the muscles, the more time that they have in that position, the more that the muscle fibers will start to relax and yield into that stretch. Again, hitting external rotation stretch of the forward leg, internal rotation of the backward leg, and that is the 90-90 hip stretch.